being here today. Of course, we all know that the inflation that we're dealing with today is not helping the situation whatsoever. And you know, people talk about insurance as though that equals care. And I think most of you on the panel know that doesn't equal care just because you have a policy. When we talk about negotiating drug costs, there's a difference between a negotiation and a dictation. And if there's a dictation and it's take it or leave it, and then you're left out, then that drug is no longer available, and it stymies the possibility for more research and development, and we have to be considerate of that. And I am bothered when I hear my colleagues say things like they want to accomplish something on this committee, but then they say Republicans are for nothing care. Well, I'm sorry, but that reminds me from a line in The Princess Bride. We are all men of action. Lies do not become us. So let's have serious conversation. We're about a healthy America is what Republicans are for. We're about prevention. We're about diagnosis and treatment and making America a healthier place. But what we don't want is the government in between the doctor and the patient. And I can tell you that firsthand, and I know Dr. Murphy can as well, and I know Mr. Nieswander can as well. That is part of the problem. So when you're trying to create savings, you created the problem, is interfering with the doctor and patient. Look, I love our safety nets. I'm proud to live in a country that has programs like Medicaid and Medicare. And especially with Medicaid, though, I want fewer people to need it, not more people on it. And that is a difference between Republicans and Democrats. Democrats call success putting more people on the government program, when we say success is fewer people needing it. When I started in practice, I had 2 employees. And if someone was sick, my mom came in. You can probably relate to that, right? And a patient came in, if it was just for an office visit, I gave them their bill, they paid it, then they submit it to insurance. Now we get the government involved. And now everything's got to change, and I got to hire more employees, and I've got to, file all the claims, and I got to have every word perfect in the chart. There was one time I had a patient, he said, "Oh, doc, how much is this going to cost?" And I said, "Well, I can numb you up here in the office, and it's about $300. And he said, "Honestly, I don't have any money." And then he said, "You know what, I raise chicken. You like chicken?" I said, "You got a deal." You can probably relate to that, too. And I didn't expect anything of him. But he delivered with that, by the way. And I took care of him. But now you can't, because now you're giving someone a special favor because of all the rules coming in from the government. Oh, no, you're giving favoritism to one person over another. How about you're helping somebody in need? And why can't that be okay? But that's where we are today. So I went from my practice, I had to grow my own administration, then I joined a large orthopedic group. And, recently, because of things like decreased reimbursement to physicians, the change in the Surprises Act that HHS put in, that we didn't put in the law, the bipartisan bill that we passed, they changed the rules to favor the insurance companies and drive down what you pay doctors. That's when they quit. And that's when they quit taking call. But that's what our government is doing. I do have a rural community in my area, and a lot of rural communities. And one of the doctors, he said, "I just don't take insurance at all, because mostly what I do are office visits. And if I have to refer to a specialist, that's when their insurance kicks in, but they just pay me a small amount, and it's half of what it would be if I was taking Medicare and everything else." And it works. It works in that environment. So we got to get the government out. And to the point, too, the other large orthopedic group in our town, they went private equity, and they quit taking Medicaid. When I first started, if I saw 1 or 2 Medicaid patients a month or something like that, I didn't care. That's about all I saw. But as the numbers grow, you can't keep your doors open. It is a business, right? And it's very hard. So my question for you, Mr. Nieswander, I think this can kind of hit home with everything, because I talked about the need to practice with very little assistance in the office. You said you have 11 employees. How many of those actually touch patients and provide medical care?
Every one of them.
So out of 11, you have them all, so there's no one who's just administrative. There's no one who's just, that's what I'm trying to differentiate.
So we have a billing company and a company that processes our claims for us. That's 2 separate companies there. We pay them a percentage out of our income as well, out of every claim that's processed.
Okay, well, for many people, that's in their office, and those are the employees.
That's correct.
So you have people producing, but you do have to pay for all the administrative burdens that have been put on us over the years. Well, I think this is what we have to focus on. And let's focus on the health of America and our patients. And be sure that when we're doing something from the government level, we're actually helping, not hurting. Now, yield back.